works. Why, hello. Let's wait until some people get in here. Hey, y'all, hey. Hey, fabulous friend. All right, guys, you guys know this is a free NCLEX Jeopardy. Hey, Doc Iggy, how y'all doing today? All right, so if this is your first time, welcome. Baby, sincerely try. What's up? If this is your first time to NCLEX Jeopardy, welcome. If you're a repeat offender, hello, welcome back. All right, so you guys know this is our free weekly NCLEX Jeopardy game where we play our NCLEX Jeopardy. Okay, it's our free review. It's about 25 questions, our 5 categories. I like to show y'all exactly kind of like what we're playing. And plus, if you download the Nurse Sam app, you also get to play the mobile version as well. So I'm going to show you guys kind of the blue screen that I'm talking about. So just like Jeopardy, you get the blue screen. All right, so these are our topics for tonight: pharmacology, peds, mental health fundamentals, and adult health. Okay, and after we get finished playing the live review from tonight, the questions from tonight's the questions from tonight's live is actually going to be on the app for free. So of course, so you guys don't obviously get the questions right before and just get the answers without doing the work. Just by having it in the app. I'm going to put it after we get finished with NCLEX Jeopardy, okay? So, of course, we're playing for prizes. So the people with the top 3 highest scores will win prizes, okay? Depending on if you have the Ultimate Nursing School Bundle. If you don't have that, that will be your prize. It is $97 with a value of $297. It's 400 pages. It's a digital PDF, which is great because of the flexibility. You can download it on literally any device. You get unlimited downloads of that by yourself. Unlimited downloads of the Ultimate Nursing School Bundle. Plus, you can print it out if you want to. Right? Anytime, anywhere. Anytime, anywhere studying. So that's why I love the digital option. So once again, if you have the Ultimate Nursing School Bundle and you want something else, then you can get some study gummies to help you with your studies. All right, this is made with lion's mane and L-tyrosine. It supports focus, memory, and mental clarity. All right, this lion's mane is amazing. This is a nootropic, which means brain food. And what that does, like I said, it supports focus, memory, and mental clarity, and it really gives you that motivational push without basically BR Adderall. So this is a great natural way to increase your motivation and mental clarity. Take 2 of these, has a strawberry flavor, and because it's lion's mane, it has a little bit of like a cinnamon-like spice aftertaste, but once again, that dissipates into a strawberry flavor. So it's delicious, and you know it is working when you eat it, okay? So great reviews on this. All right, people say to try this natural option before like being put on medication, and they said so far so great. So awesome job. Let me look at what you guys, yeah, that can be bought off my site. Hello, I'm glad you guys are studying for your NCLEX PN. This is great for NCLEX PN, NCLEX RN. I've had both BSN, ADN, LPN all use my study kits and join me on NCLEX Review, NCLEX Jeopardy Live, and say they had passed with the content that we use. So, hello. Thank you guys. All right. So, just in case you guys don't know, Thursdays are for NCLEX, our exit exam, and Tuesdays are for our ATITs, our entrance exams, okay? So, since today's Thursday, we're going to focus on our entrance exam, exit exam, all right? And you guys know, yes, these study gummies are great, already ordered, awesome. All right, guys, so let's go ahead and get started. So, a couple of ground rules, all right? So, we have 5 topics. The topics for tonight are pharmacology, pediatrics, mental health, fundamentals, and adult health. I wanted to make sure I put fundamentals in there because it is spring semester, the start of spring semester, so it is a lot of people's first day, first week, first semester in nursing school, and fundamentals and pharmacology are usually the first classes that you take. So I wanted to make sure to include those as well so you guys can get some studying in no matter what semester you're starting, okay? So how we play is I'm going to read the question, We'll read the answer choices, all right? In order for you guys to win and get it correctly, so just remember this is NCLEX Jeopardy, you have to say what is and then the answer. Okay, hold on, let me see what y'all saying. I do save the reviews for later. More on that in a minute. Let me look and see what you guys are saying. What's a NACE exam? I don't know what that is. Okay, so like I said, I'm going to read the question, I'm going to read the answers, and in order for you guys to get it first, it's going to be whoever pops up on my screen that says the correct answer. So say what is, and then whatever it is, 1, 2, 3, 4, whatever. So what is whatever, and you have to be the first person on my screen, okay? So I take screenshots and everything, so just in case like it lags for some people's internet, I don't know, I can't see your screen, I can only see my screen, so that's what I got to go off of. Okay, like I said, even though we are playing for prizes, that's just incentive to make it fun and to really motivate you guys to learn. Okay, but you know that the real prize is passing NCLEX. So really, as long as you're answering the questions correctly, you're really winning. But these prizes, like I said, are just incentives to give you a motivational push. Okay, so don't take it too seriously. Don't cuss me out just in case you didn't get it in 0.2 seconds. All right. All right, guys, so let's go ahead and start. Someone said, yes, I need pharmacology, so let's just go ahead and start with pharmacology. All right, so let's do pharmacology for, let me have my notepad. As you guys answer, I'm going to read off the points, all right? So like I said, we have our 5 categories. I already read them off. And we have each question, 5 questions each, and they're each worth like 100, 200, 300, 400, 500 points. So every time we say a category, I'm going to read off the points. And if you get that first and get that correctly, you get those amount of points. So that's how we're going to do the point system. So you guys can win your prizes for the top 3 highest scores. All right? All right, so let's go ahead and do pharmacology for 300. Okay, let's go ahead and do it. All right, so like I said, pharmacology for 300. I am going to be reading the question and the answers. And remember, you have to say what is and then whatever the answer choice is. Who's taking NCLEX soon? Ooh, the Cassie D is taking NCLEX next week. It's okay. I know that anxiety's on 1,000. That's why we're here, NCLEX Jeopardy, to kind of get you calm and get your practice, okay? All right, so I'm going to read the question. Pharmacology for 300. A client with acquired immunodeficiency syndrome who was taking zidovudine 200 milligrams orally 3 times daily has a severe neutropenia noted on follow-up laboratory tests. The nurse interprets that which change is likely to occur at this point. Is it 1, the medication dose probably will be reduced? Is it 2, prednisone probably will be added to the medication regimen? Is it 3, epoetin alpha probably will be added to the medication regimen? Or is it 4, the medication probably will be discontinued until laboratory results indicate bone marrow sufficiency or bone marrow recovery, I'm sorry. All right, I'm going to read that again. A client with acquired immunodeficiency syndrome. If you guys don't know what that is, it is AIDS, okay? A is acquired, I is immunodeficiency, is D in syndrome, all right? So a client with AIDS who is taking zidovudine 200 milligrams orally 3 times daily has noted severe neutropenia, okay, on the follow-up laboratory studies. The nurse interprets that which change is likely to occur at this point, all right? The medication dose probably will be reduced. Is it 2, the prednisone probably will be added to the medication regimen? Is it 3, epoetin alpha, I never can say that word. Epoetin alpha probably will be added to the medication regimen? Or 4, the medication probably will be discontinued until laboratory results indicate bone marrow recovery. All right, let's look and see what that answer is, and let's see who got it right. All right, so according to this, the correct answer is, what is 4? The medication probably will be discontinued until laboratory results indicate bone marrow recovery. All right, so let's see who got what is 4 first. Let's look and see. Unknown Beauty, Crystal, hey boo. All right, guys, Unknown Beauty's on the scoreboard for 300 points. All right. First person to correctly say what is for. Sincerely try. You also got it. Great job. Emmy Spinoza, great job. Ash Cash, awesome job. Who else? Keep It Up with Vicky, great job. Nike Lennox, Caramel Drip. Kyla, great job. Awesome job. Okay, so let's go ahead and go over why it was 4 and not anything else. I saw a lot of people say 1, which was the medication dose were probably reduced. Let's go ahead and say why it would be discontinued altogether until the lab results indicate bone marrow recovery instead of just reduced. All right. So rationale says zidovudine is a nucleotide reverse transcriptase inhibitor. Woo, that's a classification of that medication. All right. So hematological monitoring should be done every 2 weeks while on this medication. If severe anemia or severe neutropenia develops. Can someone tell me what severe neutropenia means? What does the word neutropenia means? Tell me in the comments, write me in the comments. Let's see who the first person is, you get 100 points. What is neutropenia? Tell me in the comments, you get 100 points. Who's the first person? Define neutropenia. Donna Camp, awesome job. So yes, it is low white blood cell, or specifically neutrophils. But yes, low white blood cells, okay? All right, so great job. Everyone that said low white blood cells, great job. Yes, specifically neutrophils. But Donna Camp, great job. You're the first person to say that. So you're on the scoreboard with 100 points. So Donna _Camp, 32. Perfect job. You're on the scoreboard with 100 points. Unknown Beauty, you still have 300. Great job, guys. Remember, we're going for the top 3 highest scores for prizes. All right, so let's go back. So if you have severe anemia, which is low red blood cells, and severe neutropenia, which is low white blood cells, that can obviously be a problem because white blood cells are part of the immune system. If you have low soldiers in your immune system, you're going to have a low immunity defense. All right, that means you get super sick, super quick, without any type of fight from your immune system. All right, so if severe anemia or neutropenia develops, treatment should be discontinued until evidence of bone marrow recovery is noted. If the anemia or neutropenia is mild, a reduction in dosage may be sufficient. But remember, they said severe neutropenia was noted in the question. All right. The administration of prednisone may further alter the immune function. Remember, if you have an immune system that's pretty much wiped out, adding an immunosuppressant is going to further suppress that immune system. That is not good. Okay, so yes, that will further alter the immune function. And then Apoetin alpha, that is a red blood cell medication that is going to be administered to clients experience anemia, not neutropenia. Okay, let me look and see what you guys are saying. Right, puts patient at risk for infection. Great job. Yes, NCLEX is very petty. They will throw in severe, mild, moderate. They're really petty with mild and moderate. Like, Sistrid, what is the difference? Stop playing with me. Mild, moderate, lukewarm, stop it. But yes, you have to be aware of the pettiness of NCLEX, all right? Sometimes you just got to accept it so you know what to look out for. NCLEX and its pettiness, so you can move around it, okay? Sometimes you just got to accept people for who they are. All right, guys, so that was pharmacology for 300. Great job. Let's go ahead and go to mental health for 400. Let's do mental health for 400. All right. Remember, you have to say what is and then the answer in order to be chosen as a qualifying answer, okay? So, during the admission assessment process, the nurse observes that a client diagnosed with paranoid schizophrenia has multiple dental caries and mouth ulcers. The client denies oral pain or difficulty eating and does not present any concern over the nurse's findings. The nurse recognizes the client's response as most likely the result of which client factor? Is it 1, apathy, 2, impaired pain perception, 3, distrust of authority figures, or 4, poor verbal communication skills? I'm going to run that back, all right? During the admission assessment process, the nurse observes that a client diagnosed with paranoid schizophrenia has multiple caries, which is cavities, multiple dental caries, and mouth ulcers. All right, the client denies oral pain or difficulty eating and does not present any concern over the nurse's findings. So the client recognizes the client's response as most likely the result of which client factor? Is it 1, apathy, 2, impaired pain perception, 3, distrust of authority figures, or 4, poor verbal communication? Let's look and see what that answer is, and let's see who answered first and correctly. All right, the answer is, what is 2? Impaired pain perception. What is 2? Impaired pain perception. Let's look and see who got that first. A lot of you guys got that. Awesome job. Yay, Morgan San Diego's here. Hey, mental health. Yes, that is our mental health guru right there. If y'all need any help with mental health, Morgan San Diego, please follow her. She has everything to do with mental health. Let me go and look. Wait, who am I? What is 2? Who is our person? Quita Boo. It is Quita Boo. Hey, Boo. Great job. You are on the scoreboard and actually now in the lead with 400 points. So, Quita Boo, great job. Underscore Boo with 400. And then we have Unknown Beauty, aka Christelle, with 300 points. And then we have Donna Camp, 32 with 100 points for answering that question. All right, remember, we still have many of questions to go, so it can be anybody's game to just swoop in and get like a 500 pointer and just really clean us all out. But once again, remember, this is just for incentive, and as long as you're getting the answer correct, that's all I care about. All right, so who else got what is 2? Bint Aquib, Donna Camp, His Express, Emmy Spinoza, Prioric, Unknown Beauty, Crafty Mill, Toya, PYT, Sudray, XO, and no, it wasn't apathy. It was impaired pain perception. Mrs. Fabulous, Fab and Dunn, Jenny Lynn, Cap Diva, Best You Ever Had, period. The Cassie D, is it Faith Iman, Morgan San Diego, of course. Leah Lachey, awesome job, guys. I haven't taken that classes, but I took a guess. Great. That just proves you're going to start thinking like a nurse. So even if you haven't taken that class yet, awesome job. So now when you do take that class, you can be like, I've been prepping for this since semester 1 or whatever semester you're in. Great job. Yay, I'm glad you found my page. Woohoo! Did you get it? His Empress? Yeah, I said you got it too. All right, so great job to everybody that said what is 2, which is impaired pain perception. Let's go ahead and go through the rationale. So a lot of people, the people that chose apathy, because remember they weren't expressing any concern over the nurse's findings, even though they had multiple dental cavities and mouth ulcers. All right, they were just denying any pain or difficulty eating, which is what you would expect, especially with multiple mouth ulcers. Those are not fun, and dental cavities. So the fact that they were denying that and not presenting any concern over the nurse's findings would probably just be apathy, but the fact that they have paranoid schizophrenia adds a certain aspect to it. Commonly, schizophrenia has effects on the pain center in the brain, which usually results in poor pain recognition. All right, so that impaired pain perception is a thing. The client is likely not experiencing oral pain to the degree that may be felt by the individual who does not have schizophrenia. So although the remaining options may be general factors that affect the client's perceptions and personal interactions, they are not related to the pain perception threshold. Specifically, in a client with schizophrenia. All right, so remember, schizophrenia has effects on the pain center of the brain, so it will lower their pain threshold. So a lot of times they will be suffering from impaired pain perception. That will be on a schizophrenic patient's care plan all day, every day. Impaired pain perception all day, every day. Okay, so yes, it was what is 2. All right, so great job to everybody that got what is 2. Let's go ahead and go to adult health / med surg, and let's do that for 200. All right, let's do that for 200. This is adult health / med surg for 200. Where's my pen? All right, here we go. The nurse has given suggestions to a client with trigeminal neuralgia about strategies to minimize episodes of pain. The nurse determines that the clients need further teaching if the client makes which statement. Is it 1, I will wash my face with cotton pads? 2, I'll have to start chewing on my unaffected side? Is it 3, I should rinse my mouth if toothbrushing is painful? Or is it 4, I'll try to eat my food either very warm or very cold? This is adult health for 200. I am reorienting the board just in case. This is NCLEX Jeopardy. Once again, I'm going to read the question and the answer choices. The nurse has given suggestions to a client with trigeminal neuralgia about strategies to minimize episodes of pain. The nurse determines that the client needs further teaching if the client makes what statement? 1, I will wash my face with cotton pads. 2, I will have to start chewing on my unaffected side. 3, I should rinse my mouth if toothbrushing is painful. Or 4, I'll try to eat my food either very warm or very cold. All right, guys, the correct answer is, what is 4? I'll try to eat my food either very warm or very cold. All right, let's go ahead and see what is 4. Let's see who got that. Donna Camp. Oh, Donna Camp came to collect, honey. All right, since you're already on the scoreboard with 100 points, you get another 200 added. So great job for answering that correctly and first. So that just boosted up your points to 300 points. And now you are tied with Unknown Beauty for 300 points. That puts you both in second place. And then we have Pretaboo in first place with 400 points. All right, so let's see who else got what is 4. 1 heart, 3 blessings. Great job. Lily's. Remember to put what is in order to be considered correct. Who else? What is 4? Shauna, and Scott. Liz Mary, Leah Lachey. Wait for it. Great job, guys. All right, so that was everybody that chose what is 4. A lot of people chose what is 2, which is I'll have to start chewing on my unaffected side. But let's go ahead and go through what the answer is. So remember, all right, so it says facial pain can be minimized by using cotton pads to wash the face and using room temperature water. The client should chew on the unaffected side of the mouth, eat a soft diet, and take in foods and beverages at room temperature. If brushing the teeth triggers pain, and or rinse after meals may be helpful instead. So those are all the, I didn't see you. Wait for it. Wait for it. That's crazy. I don't see that. It didn't pop up on my end. Maybe it's still down cam. Wait for it. I'm going through. I didn't see. That's weird. I didn't see your what is 4, but you're telling me, so I see it now. But once again, it was Donna that got it at first on my end. But yes, it was what is 4. I'll try to eat my food either very warm or very cold. So what I just read you guys was the true things or the positives. Remember, the question said the nurse determines that the client needs further teaching. So whenever you hear client needs further teaching, additional teaching, it basically means girl or sis, what are you talking about? Like, that's definitely not what I just said. They're telling you something opposite of what they should be telling you. So they're telling you things that are false. Okay, so if someone is telling you that 1 + 3 is 7, that person needs a little further teaching. It needs additional teaching. All right, they don't get it. That's the NCLEX's way of saying, love, what? That's the CDC. The CDC recommends additional teaching, okay? All right, so whenever you see further teaching, additional teaching, that's the opposite of what is true. You're looking for false. So a quick way to remember what you're looking for and not to get confused, because obviously the default is you're looking for the correct answer to the question. That's the default. So a lot of times you'll read that sentence and be like, okay, I'm looking for a false answer. And then as soon as you go through those answer choices, you're just like, okay, my brain automatically is going to assume I'm looking for the correct answer. So each time you read through an answer choice, say, okay, I'm looking for the false answer. Is this true or false? And I read it. I will wash my face with cotton pads. Is that true or false? That is true. Remember, facial pain can be minimized by using cotton pads to wash the face. And then 2, so I know that's true. So I know that's not what I'm looking for. So I know I can eliminate number 1. Number 2 says I'll have to start chewing on my unaffected side. Is that true or false? That's true. It says the client should chew on the unaffected side of the mouth to help with minimizing that facial pain. All right, so that is a true statement. I know that I'm not looking for a true statement. I'm looking for a false statement. So I can eliminate 1 and 2. 3, I should rinse my mouth if toothbrushing is painful. All right, I know that is true. It says if brushing the teeth triggers pain, an oral rinse after meals may be helpful instead. All right, so I know 1, 2, and 3 are all true statements, and I know I'm looking for a false statement. So let me go ahead and read 4, kind of knowing that 1, 2, and 3 already is not what I'm looking for. 4 says I'll try to eat my food either very warm or very cold. I know that is true or false statement. That is false. I know that's false because facial pain can be minimized by eating food or using room temperature water and making sure that every food and beverage that you take in is room temperature. So we know we do not want our food either very warm or very cold. We want it room temperature. All right, so I know that number 4 is a false statement, and since I'm looking for false statements, you're it. Okay, number 4 is it. So a little kind of trick there, just in case to keep you from getting tricked by the additional teaching, further teaching kind of trick. All right, remember, NCLEX is petty. You got to know the tricks. All right, so great job to everybody that got that, and great job to Donna who got those points. Okay. All right, remember guys, this is NCLEX Jeopardy. We are playing for the top 3 highest scores. All right, so we have Queedaboo and then Donna Camp and Unknown Beauty tied for 2nd place. All right, so let's go ahead and pick fundamentals. Let's do fundamentals for 500, okay? All right, so remember, as we play, I can only go by my screen. I'm not sure, so sometimes the internet lags on either your end or my end. I'm on Wi-Fi, but whatever. But just in case the internet lags, I can only go by what I see on my screen, what pops up first on my screen. So that's who's going to be who wins. All right, guys. Remember, this is fundamentals for 500, and you have to say what is and then the answer choice in order to be answered correct. All right, so it says, the nurse is creating a plan of care for a client receiving enteral feedings. Which client problem is the highest priority? 1, diarrhea. 2, nutrition. 3, aspiration. Or 4, deficient fluid volume. All right. Also, somebody said that, somebody asked when you would be able to see the questions from tonight. It will be after 8 p.m., after we complete our live. Okay. So the questions that you have right now are the questions from last week's live. You won't get these questions until after we finish, after we pick our winners, and after we get finished with Instagram Live. All right. So I'm going to read the question again. The nurse is creating a plan of care for a client receiving enteral feedings. Which client problem is the highest priority? All right, I'm going to let you in on a little secret. Highest priority, that word priority is another one of NCLEX petty words, okay? All right, the answer choices are, is it 1, diarrhea, 2, nutrition, 3, aspiration, and 4, deficient fluid volume. All right. It says the answer is, what is 3, aspiration? That is the highest priority client problem, aspiration. All right, let me look and see who got that first. Wait for it. Bent a Quib got that first. What is 3? So great job. You are now on the scoreboard with 500 points, and you just slid your way into first place. Y'all see what I mean? It could be anybody's game. All right, so great job, Bent a Quib. 500 points. And then Ketaboo, you're in the second place with 400. And then Donna and Christelle, you guys are tied for third place with 300 points. All right, so great job to everybody that got what is 3, which is aspiration. Bentikip, you got that first. Great job. Ketaboo, Pro Eric, MC Rivers, Miss Fabulous, Mama Misha, Love Me, Smiles Big Baby, Toya, Thick Thighs, and Peaceful, period. Love Me First, XOMM, Curran's Mom, who else? Kyla, Sunray. Yes, right, exactly. Airway, breathing, circulation. Oh, that D, disability, is that a new one? The girls always change the rules. We'll talk about it. Divine, Armani. Great job. All right, so awesome job, guys, to everyone that said what is 3. All right, so it says any condition in which gastrointestinal motility is slowed or esophageal reflux is possible places the client at risk for aspiration. All right, so diarrhea and nutrition may be appropriate problems, but they are not of highest priority. Okay, deficient fluid volume is not likely to occur in this client. All right, so remember, enteral feedings, it's going to be like our PEG tubes or enteral feedings. Okay, so once again, it says anytime your GI tract or motility or GI tract in which that's exactly what's being manipulated in enteral feedings. Whenever that happens, risk for aspiration is a very, very high priority. All right, so remember, when you aspirate, you're basically choking on your own vomit, and that is affecting your airway. And remember, whenever you're dealing with clients, you remember your ABCs. That usually helps you with priority. Obviously, if something is affecting your airway first, that's going to be your highest priority, because if you don't have no air, you don't have no oxygen, that affects literally everything else. A cascade will happen, and it usually starts with airways, which is why it is A for ABCs, okay? Airway, breathing, circulation, and apparently there's a new one, D for disability, but we're gonna focus on these airways, okay? Because by the time we get D, disability, that airway is somewhere far gone, all right? So A, airway is highest priority. In this case, it's being manipulated, it's being affected by aspiration, which is why aspiration is the correct answer. All right, now it's this. Yep, great job. So that was fundamentals for 500. Benta Quib got that. Awesome job. Remember your ABCs, guys. Okay, now we are doing not fundamentals, peds. Let's do peds for 300. Peds for 300. Every time I do peds, we come across the same, like, 5 diseases. NCLEX loves repeating these diseases. All right, so pediatrics for 300. All right, this is another reason why coming to these NCLEX games are pretty bomb, because you're basically getting questions and practice questions that you're practicing for free in a fun way. And eventually you start to pick up that whenever you take these review questions and these practice tests, they start to ask you the same thing. Like, hyponatremia is only going to be hyponatremia for it's just going to be low sodium for so long. There's only so many questions that you can ask about hyponatremia. You kind of get my drift? So, yeah. All right, so this is pediatrics for 300. The clinic nurse reviews the record of an infant and notes that the primary healthcare provider has documented a diagnosis of suspected Hirschsprung's disease. All right. The nurse reviews the assessment findings documented in the record, knowing that which sign most likely led the mother to seek health care for the infant. 1. Diarrhea. 2. Projectile vomiting. 3. Regurgitation of feedings. Or 4. Foul-smelling, ribbon-like stools. All right. So remember, go back to the question. Look for what it's asking you. All right. The clinic nurse reviews the record of an infant and notes that the primary healthcare provider has documented a diagnosis of suspected Hirschsprung's disease. All right. So A, it's a diagnosis of suspected Hirschsprung disease. We know that it's not a confirmed thing yet, so we know that these symptoms probably have not happened yet. So even though it might be what to expect in this disease, the mother may not, that most likely freak the mother out, okay? Like I said, it says the nurse reviews the assessment findings documented in the record, knowing that what sign most likely led the mother to seek health care for the infant. So in order for the mother to seek health care for that infant, she was freaked out. Something happened to that baby and was like, to the hospital we go. All right, and that, it says knowing that what sign most likely. So we're looking for like a confirmed, like a known sign of Hirschsprung's disease in an infant. All right, that would most likely send and freak out this mother. All right, is it 1, diarrhea? Would diarrhea lead this mother to go to the hospital? 2, projectile vomiting. Would that lead the mother to seek health care? 3, regurgitation of feedings. Ask yourself the same question. 4, foul-smelling, ribbon-like stools. Will that seek that same response? Will that make the mother go and seek health care? All right, let's look and see what that answer is. And the answer is what is 4, foul-smelling, ribbon-like stools. All right, let's see who got that first. The diarrhea almost tripped you up. Let's look and see. All right, so Ketaboo. All right, great job, Ketaboo. Projectile vomiting got a lot of you guys. Projectile vomiting got a lot of you guys, but we'll talk about that. All right, so I wonder what you guys thought projectile. Oh, you guys thought that was pyloric stenosis. You thought projectile vomiting was pyloric stenosis, didn't you? Because remember, and how I remember is the P in pyloric is the P for projectile. All right, that's how I remember. The NCLEX Peds people, they love pyloric stenosis, they love Hirschsprung's disease, and they love intussusception. They love those 3 for some reason. P for pyloric is projectile vomiting as far as that main sign and symptom. The intussusception, I remember, it's the telescoping of the intestines. And then this Hirschsprung's disease, it's a congenital anomaly, also known as basically a ganglionic megacolon. Just remember megacolon, okay? All right, so it occurs as a result of an absence of ganglion cells in the rectum and other areas of the affected intestine. So you won't have diarrhea, you will have constipation, chronic constipation, especially beginning in the first month of life, and results in like pellet-like or ribbon-like stools. Because remember, if you're constipated, the whole thing not coming out. So usually it's like a ribbon coming from the sides, because let's say this is the poop and let's say this is the rectum. See, there's only that little bit coming out, so that's going to come out like a ribbon. Almost like, you know, when you like squeeze like a pimple and it's like usually blocking it from coming. So it's usually not like a boom, like a burst of a pimple. It's usually those little strings and it starts to string up. That's kind of like the chronic constipation, all right? It's something in there stuck, all right? So it's going to come out in a ribbon, which is why it's going to have those ribbon-like stools. And it's going to smell. It's going to be woo, foul smelling, all right? So just think of all that poop festering in there and only coming out just a little bit. That thing is going to be stank, okay? All right, so it says, like I said, the chronic constipation that begins in the first month of life and results in pellet-like or ribbon-like stools that are foul-smelling is a clinical manifestation of this disorder. All right, delayed passage or absence of meconium stool in the neonatal period is also a sign. bowel obstruction, especially in the neonatal period, abdominal pain and distension, and failure to thrive are also clinical manifestations. Options 1, 2, and 3 are not associated specifically with this disorder. Like I said, diarrhea was for something else. 2, projectile vomiting was for pyloric stenosis, and regurgitation of feedings was also for something else. Hirschsprung's disease, remember, foul-smelling, ribbon-like stools. Okay, you honestly want to know how I remember this? Because Hirschsprung's disease sounds like Hershey's, and I think of Hershey Kisses, and I think of like the little shit emoji, or the poop emoji that's kind of shaped like a kiss, a Hershey's Kiss, and it's small, so I think about pellets, and plus it's kind of like ribbony if you look at the emoji. So in my mind, when I think of Hirschsprung's, I think of Hershey Kisses with the ribbon-like with the ribbon-like stool emoji. That's how I think of it. You don't gotta do it like me, but at least that's not how I mix up Hirschsprunger's and projectile vomiting. Remember, P for projectile vomiting is for pyloric stenosis. Hershey Kisses Hirschsprunger's is the foul-smelling, ribbon-like poop emoji, okay? Good tip. I have to give you some visuals. That is funny. All right, so, great job. Y'all will forever remember Hershey's. All right, guys. Did I choose who answered that quickly? Hold on, let me look. Please help me remember. Who was it? Wait for it. It was Ketaboo, right? It was Ketaboo. My bad. It was Ketaboo. All right, Ketaboo. So you have another 300 points added to your score. So you have 700 points. So Ketaboo is now in first place with 700 points. And then we have Bentaquib with 500. And then Unknown and Donna are still battling out for third place, okay? Remember, it's still going to be a biggest game. We still have like 15 minutes to go. All right, so that was that one. Now let's go ahead. Let me see if I missed anything that you guys are saying. I'm glad that tip helped y'all. All right, so let's go ahead and let's go back to pharmacology, and let's do 500. Let's go ahead and go there. This is a good one. Ooh, this is a good one. All right, so, and I say this is a good one because based on how many, when I say I have gone through tens of thousands of NCLEX questions for RN, PN, I have gone through question after question, from the most missed questions to the most difficult perceived questions. And I keep seeing the same type of questions. So a lot of times when I'm bringing these questions to you, it's for a reason, okay? All right, so this is pharmacology for 500. It says propofol is being administered to induce sedation in a client who is intubated and is being mechanically ventilated. The nurse should monitor for which adverse effect during infusion of this medication. So 1, itching. 2, skin redness. 3, elevated triglyceride levels. 4, signs of respiratory depression. Propofol is being administered to induce sedation in a client who is intubated and being mechanically ventilated. The nurse should monitor for which adverse effect during infusion of this medication. This medication being propofol. So 1, itching. 2, skin redness. 3, elevated triglyceride levels. Or 4, signs of respiratory depression. Let's look and see. All right, the correct answer is what is 4, signs of respiratory depression. Let's see who got that one first. Let's look and see. Best you ever had. Great job. Best you ever had is the first person to get that. So, best you ever had, you are now on the scoreboard with 500 points. Awesome job. Is it ever? Ever. Let me look. It's ever. 500 points. Yahoo! All right, so that means you and Bentequip are tied for second place. Great job. All right, so remember, Keita Boo's in first with 700. And then we have Bentequip and Best You Ever Had for 500. And then Donna Kemp and Unknown Beauty battling out for third place as well. All right, so great job again to Best You Ever Had. Donna Kemp also got it. Bentequip, Jackie 9, M. Krivas, Amaya, AMXY, Envy Me, Miss Fabulous Friend, Faith Man, Sue Young, Glita. Great job. Pink China. Wait, y'all are saying no. On my screen, it's Best You Ever Had. She's first. Let me take a screenshot so I don't get cussed out. Yeah, it's Best You Ever Had over Donna for me. I know. I'm looking at it. I'm sorry. It's. I have to go by what my screen says. So Best You Ever Had, you got it. So once again, great job. All right, let me look and see what this says. It says propofol is an anesthetic agent that is used to provide continuous sedation in a client receiving mechanical ventilation. Adverse effects include respiratory depression and cardiovascular depression. Itching, skin redness, and elevated triglycerides are possible side effects, but not adverse effects. I did not know about the elevated triglyceride parts. You're not going to remember everything about every disease, about every drug. Please do not try. Please do not beat yourself up just in case you forget like one of the thousands of side effects. That's why you go through and practice makes perfect, okay? But just in case you just forget something, an educated guess, do your best. Don't get tripped up on it. Remember, NCLEX is still timed, and you still have however many questions to go. Please don't expect to remember everything because you just won't, all right? But it's best to give yourself grace and know that you are putting your best foot forward and that you have studied and done your due diligence in preparing to take the NCLEX, whatever exam you're about to take. Because sometimes people love to use this for their exit HESI or their exit ATI, but this is specifically for your NCLEX, which is still an exit exam. So remember, put your best foot forward, and that's really what matters. So, great job to everybody that got what is for. I know, it may have been like literally like a second split, and then it just like came up. But, like I said, we have plenty of questions to go. All right, so we just did farm for 500. Let's go ahead and do... we have 3 more 500s to do. Let's go ahead and do them. Let's do mental health again for 500. Where my dog Morgan at? Where you at? All right, guys. All right, so this is mental health once again for 500 points. It can be anybody's game. Remember to say what is. I'm going to read the question. I'm going to read the answer choices, and you guys are going to go and do them. All right, so it says the nurse who was reviewing the record of a client admitted to the mental health unit notes that the client was admitted by voluntary status. Based on this fact, what assumption can the nurse make about the client? Is it 1, the admission will last at least 21 days? 2, the client is not a danger to himself or to anyone else? 3, the admission is being financed by a third-party payer? Or 4, the client has the right to demand and obtain release from the hospital. Let me read that one more again. The nurse is reviewing the record the nurse is reviewing the record of a client admitted to the mental health unit and notes that the client was admitted by voluntary status. Based on this fact, what assumption can the nurse make about the client? Is it 1, the admission will last at least 21 days? 2, the client is not a danger to himself or to anyone else? 3, the admission is being financed by a third-party provider? Or 4, the client has the right to demand and obtain release from the hospital? What is our answer? Answer is what is 4. The client has the right to demand and obtain release from the hospital. Remember, they were admitted to the mental health unit on voluntary status, which is very different if they were admitted by involuntary status. Okay. It says generally voluntary admission is sought by the client or the client's family member by written application to the facility. Voluntary clients have the right to demand and obtain release, sort of like against medical advice. They have the right to say, look, goodbye, all right? Yes, they have the right to demand and obtain release from the hospital. The remaining options are not necessarily true when considering a voluntary admission. No shade, Scott Disick, but I always think about Scott Disick because he used to always be admitted into those voluntary like rehab places. No shade, no shade, no shade. And he will like, it's supposed to be like a month, and 2 weeks later he'll be like, I'm out. I am out. So voluntary, you have the right to obtain a release and check up those juices. No shade, Scott. I'm sorry. All right, let's see who got what is 4 first. What is 4 first? Can we do something for 1,000? What is 4? Donna Camp. Donna Camp came to play. A lot of people chose the client is not a danger to himself or to anyone, and like we said, that's not necessarily true. Especially if you have like a manipulative client, like especially if they know they're a danger and they're just like, yeah, I know, I'm just gonna a psychopath. Sure, let's go ahead and voluntarily admit me, but that doesn't mean I'm not a danger to myself. I can still agree to get help if I'm a danger to myself, or to someone else. You don't necessarily have to be a psycho, but especially if you know, like you're severely depressed and you know that you're having like suicidal thoughts and you're a danger to yourself, you can choose to get help voluntarily. Like, I need to check myself in. I remember who did that on a TV show. Joe Wilson on Grey's Anatomy in the later scenes after she found out that she was like the product of like a rape baby, and it really messed her up, and that's why like her mom didn't want her. So she chose to voluntarily commit herself to like an inpatient medical facility. So that's an example of how a client is not a danger to himself or to anyone else is not necessarily true with someone who is voluntarily putting themselves in a mental health unit. If that makes sense, I hope so. Right. Right, Donna was first on mine. I said I was going by my screen. I can't see your screen. I'm so sorry. Like I said, we are playing for prizes. Y'all are winning this stuff for free. I'm so sorry if it's lagging on your end. I can only go by my screen. I'm so sorry. If you just want to play without the aggravation of, you know, not being first based on this screen, like I said, we're playing for prizes as incentive. The real prize is you passing NCLEX, boo. Hey, then you can travel nurse and do whatever you want to do. All right, so we're playing for prizes. It's not that serious. I love you so much. All right, so great job to Donna. You got another 500 points added. So you are now in first place with 800 points. So close to the 1,000 club. All right, so now we have Donna Camp in first place with 800. Then we have Peekaboo in second with 700, and then Bentakib and Best You Ever Had. They are going head to head with 500 points. Thank y'all, sir, for saying y'all appreciate this. Thank you so much, because it's free and you get it for free. So, yep. So glad y'all feel me, and we're on the same wavelength. All right, guys. So let's go ahead and go to our next question. And it is, like I said, we're still doing 500 points because we're just going to go there. Let's do Pete's. Let's do Pete's. Okay. All right. So once again, Pete's for 500 points. The nurse is teaching the parents of a child with growth hormone deficiency about preparing synthetic growth hormone and administering it to the child. Which statement, if made by the parents, would indicate an understanding of the procedure? 1, we will rotate injection sites. 2, we will give the injection weekly on Monday. 3, we will administer the injection every morning. Or 4, we will store the mixed growth hormone in the medicine cabinet. All right. The nurse is teaching the parents, I'm reading again. The nurse is teaching the parent of a child with growth hormone deficiency about preparing the synthetic growth hormone and administering it to the child. Which statement, if made by the parents, would indicate an understanding of the procedure? I'm going to stop right there. Remember, we talked about the pettiness of NCLEX and sometimes how they like to just switch some words up. They either want to know if this question or if this statement indicated an understanding, so you're looking for true answers, or if it indicated the need for further teaching. That's when you're looking for false answers. In this case, it said which statement would indicate an understanding of the procedure. So we're looking for true statements. All right, so another trick, like I said before, with looking for false statements, just read each one and ask yourself, is it true or false? All right, in this case, the answer, we will rotate injection sites. That is true, and the answer is what is 1. All right, so let's go ahead and look and see who's the first person that said what is 1, and it's actually Pro Eric, because I saw you put it. Great job, Pro Eric. You are on the scoreboard with 500 points. Great job. Let me see who else got what is 1. Amaya, you were right there next to him. Unknown Beauty, Donna Camp, Toya Luxury Events, Smile Big Baby, Liz Marie, Divine, Black Love Plus, The J Obsession, wait for it, Corin's Mom, Danielle, Sculptastic. Great job, great job. All right, so it says synthetic growth hormone comes in a powdered form. All right, that must be diluted in order for it to be administered. It is given as a subcutaneous injection 6 or 7 times per week as prescribed at bedtime, so QHS. Parents are taught that once diluted, the hormone preparation is to be stored at 36 degrees to 46 degrees Fahrenheit, which is usually just refrigerated, girl. Refrigerate after opening and diluting. All right. Injection sites should be rotated. That is very true. Once again, which is why number 1 is the correct answer site. That prevents, actually, y'all tell me, 100 points. Why do we want to rotate injection sites? Put it in the comments. Go. For 100 points. Why do we rotate injection sites? Yeah, I'm reading the rationale now. Why do we rotate injection sites? So it's basically to prevent and avoid that buildup of like fatty tissue, which especially that occurs like when shots are given in the same spot. It also helps prevent bruising, but that main priority is to make sure that you're getting the maximum absorbency of that medication. And if you have that buildup of fatty tissue, eventually that's going to start decreasing it. Right. Wait, let me see who said it first. 1 second. Yeah, best you ever had, you said it first. To prevent from fat absorbing too much and clotting. Great job. All right, so best you ever had, 100 points. Everybody that got that, great job. Like I said, as long as you guys know it, is what I'm looking for. All right, so best you ever had, you have 100 points added, so you have 600 points. Let me go back to the question. All right, so reading the rationale. Remember, it says synthetic growth hormone comes in a powdered form that must be diluted for administration. It is given as a sub-Q injection 6 or 7 times per week as prescribed at bedtime. Parents are taught that once it's diluted, the hormone preparation is to be stored at 36 degrees to 46 degrees Fahrenheit, aka in the fridge. Injection sites should be rotated, which will direct you once again to the correct option, which was number 1. And you want to rotate those injection sites because you want to avoid that buildup of fatty deposits, which will in turn affect absorption of that medication. All right, bruising is also something that you want to do, but that's more so for vanity. Of course, you want to make sure that that medication is being absorbed over bruising and cosmetics. So once again, that absorption is that real main reason, but also for the comfort of that patient as well. Awesome. Yay, I'm glad you guys are loving this review. All of these review lives have been saved, and trust me, I'm coming to you with the vault, okay? Just be a little bit more patient with me. Wait, let's do, all right, this is our last 500, guys. What is that fatty deposit term? I'm not sure what you're thinking about. Adipose? Okay, so adult health for 500. All right, ready? The nurse is performing an admission assessment on a client diagnosed with parenchyma. Let me show it to you guys. The nurse should plan to assess which part of the integumentary system, that's the word, parenchyma, Paronychia. The nurse should plan to assess what part of the integumentary system first. Is it 1, nails, 2, hair follicles, 3, pilosebaceous glands, or 4, epithelial layer of cells? What of skin? All right. I see y'all saying what is 1. If it is what is 1, best you ever had, got it. Let's look and see. Wait, that's not it. Woo, it's what is 1. All right, guys. The answer is what is 1, and the first person to get that is best you ever had. Awesome job. And then it's Amaya, Kyla, Lily's, Miss Fabulous Fran, Cutie Ash, Unknown Beauty, the J Obsession, Serena. Awesome job. All right, so let's go ahead and read through. It says parenchyma is a fungal infection that most often is caused by Candida albicans. What is Candida albicans? What type of, oh hell, it just literally just told us. Fungal infection, never mind. This results in inflammation of the nail fold with separation of the fold from the nail plate. The affected area generally is tender to touch, and the purulent drainage has purulent drainage. Remember, purulent is basically like pus. Disorders of the hair follicles include folliculitis, funicles, and carbuncles. Those words are so funny to me. Disorders of the pilosebaceous glands include acne vulgaris and seborrheic dermatitis. A variety of disorders may involve the epithelial skin layer. All right, so the answer was 1. Parenchyma, once again, is a fungal infection of the nail. And it's caused by a yeast infection. It's caused by a fungus called Candida albicans. All right. That results in inflammation of the nail fold with separation of the fold from the nail plate. That is what parenchyma means. I had a feeling parenchyma, is that like, hold on. Let's look up that word. Did you guys know what parenchyma or Did you guys know what that was before knowing that it was that infection? That it was basically a nail infection? Is that what... Okay. The parenchyma is actually the epidermis bordering the nails. Basically what I was trying to say is, like, is there like a suffix or like prefix that kind of hinted you guys to what it was? But I know for me, I surely did not remember that the parenchyma is the epidermis bordering the nails. To be honest, I wasn't really that good with the integumentary system. I'm gonna be honest. I'm gonna be 1,000 with you guys. I don't really like remember the integumentary system like that. But during that time, nursing school, I had to really make it fun, because y'all know if it's not fun, I will not retain it. Period. I can't even fake it. So that is why I do stuff like this with NCLEX Jeopardy. So last person to get that answer, once again, was best you ever had. That was another 500 points. So best you ever had, you just got 500 more points added to your already 600 score. So that puts you in first place with 1,100 points. So you officially crossed over into 1,000 point land. So great job. Very few people, I'm just kidding, almost everybody like makes it. At least one person every NCLEX Jeopardy or ATITs makes it into the 1,000 range. Great job for it being you. So best you ever had, you're in first place with 1,100 points. Please send me your full name, your email address, and your shipping address to get your prize. If you have the Ultimate Nursing School Bundle, let me know what else you would like. If you don't have the Ultimate Nursing School Bundle, congrats, that's exactly what you got. The 400-page digital Ultimate Nursing School Bundle to help you through whatever semester, all the way through you taking your NCLEX, all right? So, great job, best you ever had. Second place is Donna Camp. Let me see. Lipodystrophy, the term I was thinking. Oh man, that's not the term I was thinking of. All right, second place was Donna Camp. Congrats. Yay! All right, so Donna Camp, you are in second place with 800 points. Congratulations to you, because you were like, I think you were second on the scoreboard, and then towards like the end you were just like, let me grab all these points. So great job to you. You are second place. If you once again don't have that Ultimate Nursing School Bundle, please send me your full name, your email address, and your shipping address, and that Ultimate Nursing School Bundle is yours. If you already have it, DM me an alternate, and we'll work that out. All right, now third place winner is Ketaboo. Ketaboo! Great job. All right, so you are in third place with 700 points. All right, awesome job, Ketaboo. Same thing goes for you. All right, send me your full name, email address, and shipping address for your prize. If you have the Ultimate Nursing School Bundle and want something else, send me a DM with that information and whatever else you want, and we'll work that out. If you do want the Ultimate Nursing School Bundle, just go ahead and include that and be like, yes ma'am, I want the bundle. Okay. All right, so also you guys, during Tease Tuesday, we had some winners that had already like pretty much passed nursing school, but they were just kind of playing for fun. But they decided to donate their winnings to the people that won, that didn't make the top 3 of today's NCLEX Jeopardy. So our 4th place winner, who's Bent Akib, all right, somebody donated their Ultimate Nursing School Bundle to you. So even though you're not our top 3, you still get an Ultimate Nursing School Bundle if you accept it and don't already have it. All right, so Bent Akib, once again, congrats to you. Somebody actually donated their Ultimate Nursing School Bundle winnings to you, to the person that won 4th place. So congrats again. Remember to send me your full name, your email address, and your shipping address so you can go ahead and get your prize. So congratulations, best you ever had, Donna Camp 32, Keita Boo, and Bint Akib. Congratulations, you guys won the Ultimate Nurse Skill Bundle or something adjacent. All right, let me look at what you guys are saying. I'm so glad you guys enjoyed this review. Like we said, I do this every Thursday. On Tuesdays, I do Tease Tuesday. We do it for the pre-nursing students or the people that need help with the ATITs or getting into the nursing program with whatever entrance exam. Sometimes it's the ATITs, sometimes it's the HESI. But we mostly do it off of ATITs. And that review's on Tuesdays at 7 p.m. right here on Instagram Live. And then on Thursdays, it's for my nursing students and for my nursing graduates, everybody that needs to pass their NCLEX, whether it be PN, RN, whatever, whoever needs to pass the NCLEX and just come for a very fun review, a creative review where it's very motivational and low. I wouldn't say low competition because we do it based on prizes, but you won't get that sense of test anxiety because we make it a fun atmosphere. All right, so thank you guys for joining me. So I learned a lot. Yay, I love it here. All right, so once again, remember. No. Okay, writing notes in your new Nurse Life Planner. Have y'all gotten your new Nurse Life Planner? Ew. Should I do another giveaway? Should I do another giveaway for the Nurse Life Planners? Let me know. All right, guys, remember to get your Nurse Life Planners. Remember to get your study gummies to support your focus, mental clarity, and for your memory. All right. And if that's not it, now I'm going to go ahead and update the questions in the app. All right, so if you download my app, the Nurse Sam, you can go to iOS, Android. It's completely free. Just literally type in the Nurse Sam as you search for apps. The Nurse Sam. You'll see my logo. It's a free app. Go ahead and download it. And if you go to NCLEX Prep, you will see the mobile Jeopardy banner. So you can play tonight's mobile Jeopardy version. Did I just do it? Wait for it. Oh, I sure did. All right, so now you see the rest of the questions from tonight's game. Like I said, it's total 25 questions, and we probably did like less than 10, to be honest. So you still have buku points, and not points, but you have buku questions to practice and review on until your next set of 25 next week. All right, so thank you guys so much for playing. Remember, you can go to my stories, and I will put the link so you guys can download the app so you can play the mobile version on your phone, by yourself, anytime, anywhere, with your friends, with your nursing student friends, wherever. So you can just have that fun review for the rest of the questions of NCLEX Jeopardy. All right, so I will see you guys later next week for NCLEX Jeopardy, and then Tuesday for Tease Tuesday. If you have any questions, go ahead and email me, send me a DM.